I now recognize Mr. Bilirakis for his 5 minutes.
Thank you, Mr. Chairman. I appreciate it. I'd like to ask for unanimous consent to insert into the record 2 letters, one from the American Veterinary Medical Association and key animal health and medicine stakeholder groups, and the other from 39 state attorneys general, both letters urging passage of the bipartisan bill I co-lead with Representatives Panetta and Representative Pfluger, the Combating Illicit Xylazine Act, H.R. 1839.
Without objection.
Thank you.
So ordered.
Thank you. I'd like to ask for unanimous consent to insert into the record a letter from the National Association for Children's Behavioral Health in strong support of my bipartisan bill, the Ensuring Medicaid Continuity for Children's on Foster Care Act, which I lead with Representative Castor.
Without objection, so ordered.
Thank you. So my first question is, my bill will ensure that qualified residential treatment programs are exempt from being considered as institutions for mental disease, which are prohibited from drawing down Medicaid funds for medical services. QRTPs are one of the few residential settings that have strong oversight and accountability due to the federal qualification accreditation requirements, improving outcomes for children with acute mental health needs. Unfortunately, QRTPs have been inadvertently, I really believe this, inadvertently considered as IMDs under the law, which could prevent additional options for foster children in need of care. I was glad to see CMS supports this change, since it allowed states to lift the IMD exclusion for QRTPs under the 1115 waiver. I do not believe that QRTPs were ever intended to be considered IMDs, and while I strongly support the goal to ensure all foster children get placed in family home settings, unfortunately, the reality is there's a shortage of licensed foster homes available for children in need of care. Unfortunately, again, it's very sad. And reports have recently revealed some states have resorted to, believe it or not, and I have the article here, putting foster kids up in casino hotels and juvenile detention centers and other desperate settings, since sadly they have nowhere else to go. And we've got to rectify this. QRTPs can help fill this clear continuity of care, again, with the Medicaid program by providing qualified care on a temporary basis. So, Mr. Blum, will you commit to working with us to ensure that foster children have the appropriate Medicaid coverage for medical services in appropriate settings that can provide care for their mental and behavioral health needs? If you could answer that, I'd appreciate it.
Yes, sir. We'd be very happy to work with your office.
All right, very good. Next question. I don't have a lot of time. Next question. Dr. Jones, you spoke to CDC's drug overdose surveillance and epidemiology system and the work that is being done to collect and analyze data to better understand the opioid overdose epidemic. It seems to me that electronic health records and hospital discharge records may only provide a narrow scope of information, since many struggling may not officially use the healthcare system or seek care. As the substance abuse epidemic shifts, I believe we must also shift our data collection mechanisms. What role could wastewater surveillance, which is appealing because it protects individual privacy, play? So what role will it play in identifying clusters of drug utilization and changes in trends and suspected drug overdoses at the local, state, and regional levels? What role can that play, the wastewater surveillance, please, sir?
Thank you for the question. Certainly, we have seen the value of wastewater in response to COVID. We've used that same approach for mpox and other infectious diseases. There are ongoing discussions about how do we best utilize the potential for wastewater surveillance in the overdose crisis. We have prioritized dose, which you mentioned as a syndromic surveillance system, toxicology data, emergency medical services data, other data that can connect the substances being used with the outcomes we're trying to prevent. But there is an interagency group that is really thinking through what are the ethical resource needs, what are the community acceptability levels for drug-related wastewater testing. So it's an active area of discussion. Certainly happy to come back to the committee and work with the committee as we continue to explore how best to use wastewater within the context of the systems we already have.
Please, I appreciate that. I think we're onto something. Thank you very much, and I yield back.
Thank you. The gentleman yields back. The chair now